Hello, good morning. Welcome back to the second session on the Sunday morning. I'm Dr. Gabriel Yip, a private cardiologist. Together with me, the co-chairs, Dr. Gum and Dr. Joe Lee, and also Ms. Low, who is also a nurse in the catheterization lab in the Prince of Wales Hospital, Hong Kong. Today we have a topic is basically on the nursing role in the structural heart disease. So we have invited 4 speakers with nursing backgrounds to give us the talk on the relevant subjects. The first speaker is Mr. Wong Zap Yun. Mr. Wong is an advanced practice nurse in the Prince of Wales Hospital. He graduated from the Chinese University of Hong Kong with bachelor degree in nursing and master degree in science in cardiology. After graduated, he has practiced in hospital authority for more than 10 years. In the course of the past 10 years, he accumulated valuable experience in the field of cardiology and specialized in cardiac care nursing. He further explored structural heart interventions in Prince of Wales Hospital for years and has taken a major role in the development of structural heart interventions in his unit. He has been in charge of the coronary care unit in the Prince of Wales Hospital. Presently, he is responsible for Cardiovascular Intervention Center. His duties included primary care of patients in acute ward setting, assisting the operation duties in Cardiac Intervention Center, handling cardiac emergencies, management of manpower, equipment, and protocols. Today, his topic is on the role of cath lab nurses in structural heart intervention, the Hong Kong experience. Mr. Wong, may I ask you to begin?
Thank you, doctors, and good morning, all the audience. And today I'm going to share my experience in cath lab nurses in Hong Kong in doing the structural heart interventions. And firstly, let me introduce our cath lab in Prince of Wales Hospital. Our cath lab is mainly divided into 3 parts: the control room, the laboratory, and the recovery areas. And in the control, our nurse mainly is doing the admission work and the monitoring and coordination with all the parties. And our control nurse will be the first one to approach patients, so we need to, of course, checking the patient with correct patient identity and checking all the patient with valid consent, and all the physical preparation is done. And we have made a preoperative structural heart intervention protocols with the doctors so that the ward can be following the protocols and all the instruction by the operators and these are being followed. The protocols include the medical regime and all the physical exam needed. And very often the operators is busy on the imaging, the handling of the device. They may not have an extra eyes on the hemodynamic monitor. So our control nurse will be the one as a gatekeeper watching over any change in blood pressure and any change in rhythm or any desaturation happen during the procedure, and make an early reporting to the operators. And of course, we need to take some special parameters during the structural heart intervention. For example, when we are doing the TAVI, we need to measure the left ventricular and aortic blood pressure gradient, so for proper reporting and for any future analysis. And a control nurse will be the one speaking to the operators for any special instruction or any equipment required. Basically, we will make a procedure plan prior to the procedure so that everyone is sticking on the plan to make sure the procedure is running smoothly. And we will liaise with the ward staff, the NES team, for arrangement of patient transfer in and out of the cath lab so that no lab time is wasted and all parties are aware of the schedule. And of course, we will have to discuss with the vendor to arrange the product and the product specialist's arrival before the procedure. And let's move on to the laboratory. Firstly, of course, we have to set up our lab. Unfortunately, our lab is not dedicated to structural heart intervention, so we always have to switch between doing PCI or ablation, peripheral vascular intervention, and doing the structural heart intervention. We have to move in and out of the equipment to make sure that all necessary consumable equipment is available. And after we prepare the equipment and environment, we have to set up the operation trolley. And after the patient entered our lab, we will be setting out our runner with the setting up the hemodynamic monitoring and gave all the consumable to the operators. And they need to be operate the temporary pacing machine for rapid pacing during TAVI and make sure that the activated calling time is suitable for the procedure. And I have encountered, sometimes we may encounter the cardiac emergency, for example, cardiac tamponade that require immediate cardiac tapping, or I have also encountered several times of cardiac arrest that need immediate resuscitation. And almost all our structural heart intervention procedures are done in general anesthesia or monitor anesthesia care. So we have to be working with our NES team and help them to prepare medication, help them to intubation or insertion of arterial line monitoring, the central line, and also assist in transesophageal echo probe insertion. So another important role is our nurse crimper. During the TAVI, our valve is all crimped by our trained and qualified nurses. And we need to check for correct orientation and correct mounting of the valve before the implant. And our nurse will be the scrub nurse to assist the interventionalist to handle the medical equipment and also tidy up the OT table. And after the procedure, it is not the end of the nurse role. And when we are in the recovery area, our nurse need to check for the hemodynamic monitoring, for the heart rhythm change, or any the airway assistive device function, or any temporary pacing function in the recovery area. And we have to check the peripheral circulation. We'll be using the Doppler machine to check for any distal emboli or any problem happen in the peripheral circulation. I've encountered sometimes we have a distal limb ischemia or failure in closure device that needed immediate peripheral vascular intervention after the procedure. And sometimes we have to check for the neurological status of the patient. I've encountered times of transient ischemic attack or even intracranial hemorrhage after the structural heart intervention that need immediate neurological intervention. And of course, we have to watch for any wound complication, for example, bleeding or hematoma in the SS site. Because when we are doing structural intervention, there are large pore of sheath needed. So there are times where we encounter wound complication, which is may lead to very serious events. And we have to familiar with the operation of CCAM and any other pressure device in the recovery area to handle the wound. And we have made a post-operative structural heart intervention protocol for our nurse to follow in the recovery area so that no instruction by the operator or NES is being missed. And the protocol can make our case handover to our nurses more efficiently and more clearly. And there are other nurse roles, including trainer. We are training our nursing staff to be able to take every role in the cath lab when doing the structural heart intervention and make sure that they are familiarized with every procedure in the lab. And of course, we have to train our nursing staff to be the nurse crimper, which takes intensive training, and special thanks to Ms. Cecilia Chan for helping us to train our first batch of nurse crimper in Prince of Wales Hospital. And another important role of nurses in cath lab is to participate in the heart team. We have to discuss with the doctors for any problem we encounter when we are running the lab, and any special concern we are having during the intervention, so that every parties in the heart team can understand our situation and make some new improvement. And that's it for our nursing role in a cath lab. And I think nurse really take a very important role in the structural heart intervention. So to make sure that the procedure is running well, and make sure that the patient is having a safe procedure, to make sure the lab is running smoothly. And that's all for my presentation, and thank you, everyone.
So I have the honor to ask my Dr. Gum to introduce the next speaker to you.
Thanks, Gabriel. So it's my honor to introduce the first speaker. So Ms. Chao Mei Yi. She's actually the nurse consultant and served in hospital authority. She joined the cardiac service over 20 years and encountered the evolution of the cardiac service development. Thus, the several experience on cardiac disease management and related nursing care were gained throughout her career pathway. Ms. Chow completed her nursing study on degree and Master of Nursing in Hong Kong U, as well as CUHK. Besides, she had attended the overseas training on adult congenital heart disease in UK and learned specific clinical knowledge on management of the ACHD patients in ward concerning the physical and psychosocial care, as well as the discharge follow-up. The knowledge which can be used in caring these group of patients in her working area. Apart from the clinical experience, she got her experience on cardiac-related nursing knowledge sharing throughout different lectures or conference presentations. So her topic today is the role of SH nurse, coordinator from Hong Kong experience. So the floor is yours. Ms. Chow, please.
Okay. Hi, good morning. Thank you, Chair, to have introduce myself to you. And today it's my pleasure to have a chance to share the topic for you. So in this 10 minutes, I will share the topic with you regarding to the role of a structural heart nurse coordinator Hong Kong experience. So this is a disclaimer during this presentation. And as a cardiac nurse, interventional cardiovascular nursing is a critical care nursing specialty, which providing complex nursing intervention for patients from elective admission to critical ill patient, which requires percutaneous treatment of the cardiac disease. So I think in cath lab, every day cath lab nurse will deal with the patient with the coronary artery disease, cardiac arrhythmia. So every percutaneous procedure or some maybe the implantation procedure regarding to this those disease, the cath lab nurse should have the role to manage every day. But during this two decade, the advance of the technology regarding to the heart disease, I think is a structural heart intervention becomes a common procedure being performed in the cath lab. So what's the structural heart intervention? It's a new branch of percutaneous treatment, covered a wide range of some congenital heart, apart from coronary disease, congenital acquired disease that was previously treated surgically and simplified, not addressed. So regarding to those group non-coronary artery disease patient, we focus the structural heart in the septal defect to acquired vascular disease. So mainly those disease require percutaneous approach is mainly work on performed inside the cath lab. So the requirement of the cath lab is mainly focused on the patient lab with the GA approach and some facility with a special arrangement. Regarding to the structural heart heart intervention, not only the interventional cardiologists be able to manage for all procedures. That's why required a multidisciplinary approach, including different discipline cardiologists to participate inside the procedures. So continuous training and knowledge to different disease material or device need to be treated in different diseases required. So focus on the structural heart disease, and we are mainly focused on the different approach inside the heart, the valve, septum, maybe the occlusion problem, fistula problem, and even other problem for the prevention is included. So according to my center, during these 10 years, we can see the common structural heart procedure, the numbers of patients received is gradually increased, especially for some complex structural heart intervention is increased every year. So I think cath lab nurse should be faced with new challenge to manage those disease. Those patients with such structural heart procedures. So what's the structural heart nurse coordinator be defined? Maybe structural heart nurse inside the cath lab required a leader to manage or to coordinate all the cath lab procedure, all the cath lab management for the nurses to follow. So as a nurse coordinator, he or she should be independent, accountable nurses for effective management and coordination of the patient, primary being evaluated structural heart procedure. So the nurse should require the advanced nursing knowledge skill to ensure the patient safety and optimum clinical outcome. So they should be able to adapt some new technology and advanced structural heart procedure. So role of the structural heart coordinator in Hong Kong experience, I think in Hong Kong nowadays, there's no designated nursing coordinator position in our organization. So mainly the nurse coordinator, the role of the nurse coordinator is shared by our cath lab nurse, the in-charge nurse, and maybe the experienced nurse who will share the workload for who share the work to manage the patient. So the nurse coordinator, the role should have a focus to coordinate the patient and provide a seamless, continuous care from the patient before the procedure, which means that receive the referral and then keep on the working process to follow up. So what's the role for them, for the nurse coordinator regarding to their work process, focus pre-operative phases. Nurse coordinator should have the responsibility to provide patient-related issue and address, which means that the patient who once we receive the referral, the doctors will arrange the follow-up or maybe have some preliminary preoperative assessment for them. So arrange a esophageal echocardiogram or maybe some corneal angiogram, CT angiogram to have to have evaluated the status which the patient is fitness to proceed the operation. So nurse coordinator who will coordinate the patient, or their family to have the interview to explain, to educate the related procedure to them and prepare all the preoperative preparation, and also provide the education and operational procedure to his family members. And the second is concerned the lead program organization, because the NEP is not it's required a special design for the procedure to work out. So workflow design for an arrangement should be concerned, and preoperative checklist, preoperative protocol or some record form should be prepared or designed for the procedure, each of the procedure. So concerned the stock or some consumable management, nurse coordinator is one of the roles to manage before the procedure. So and other is concerned the manpower allocation inside the cath lab. The other one is the other concern is nurse coordinator should have the responsibility to liaise with multidisciplinary team for communication. Yeah, this communication regarding to interdepartmental staff, technology and logical support, and also the other essential device, instrument and consumable item to make sure the process is run smoothly. And nursing education and teaching to our CAT-NAP nurse is also important. Okay, our heart team is not only the nurse and doctor, is also include our variable team staff to manage or to work out for the procedure. So focus on the intraoperative phases as a coordinator. He or she should maintain a patient safety and quality of care, because each procedure is critical during the patient lie on the bed. So strictly to handle the environment and aseptic skin preparation is important. And the CAT-NAP position allocation, which means that the nurse coordinator should have good organization, dedication, each of the nurses to have their own position to perform, to run the operation. Ensure the proper workflow and supervision during hardware crimping procedure by CAT-NAP nurse. This means that the nurse coordinator should have the right, the authority and the ability to manage or supervise the nurse who undergo the crimping process, make sure no defect was happened. And also,
Ms. Chow, excuse me, sorry, because of the very tight schedule, could you just go to your summary?
okay,
Because, yeah,
okay,
thank you.
sorry. Okay, also intra-operative phase will include the back post-operative back arrangement and the emergency support. And this is just the design layout for the coordinator to arrange and also the crimping process, emergency item preparation. So the post-operative management should focus on the patient and the coordinator to participate in SOPD follow-up and the arrangement for the patient. So ultimate goal for the nurse to manage all the procedure is to ensure the patient safety. So our way forward is focus on the nurse coordinator is have a great challenge because new advance for the doctor to make the nurses should be empowered his or her knowledge in every procedure, every knowledge. So our presentation is the end of this part. Thank you very much.
Thank you, Ms. Chow, for a very enlightening talk. So Gabriel, will you introduce the fourth speaker?
Sure. I have the honor to introduce the next speaker, Ms. Cecilia Chan. Ms. Chan is currently working as the nurse consultant in cardiac care in Kowloon Central Cluster Hospital Authority. She is currently the president of the Hong Kong College of Cardiac Nursing. She has been the nurse in charge of the cardiac nursing service in the Queen Elizabeth Hospital since 2016. With her knowledge and commitment in cardiac care nursing, the first cardiology nurse clinic has been accredited by the Hospital Authority headquarters in the 2012 in Hong Kong. Other than the clinical services provided, Cecilia actively takes part in cardiac nurses stimulation training in ECMO, Impeller, and structural heart intervention. She is the core member in setting up 24/7 primary PCI program in Kowloon Central Cluster, and also the coordinator of the structural heart team. Academically, Cecilia actively participates in academic activities of the cardiac team of the Queen Elizabeth Hospital, as shown by the numerous abstracts presented, publications, and research projects. Without further delay, may I ask Ms. Chan to present her talk on my vision on the role of nurses in the structural heart intervention development. Ms. Chan.
Good morning. Thank you, Chair, for your kind introduction, and also thank you, organizing committee, for the invitation. As structural heart intervention is continue to develop, the role of structural heart intervention, the role of the nurses in structural heart intervention also evolve, but it is different in different countries and also in different hospitals. So today I'm going to share with you for my vision on the role of nurses in structural heart intervention. Actually, I witnessed the change of nurses' role in this specialist service since I was assigned as a TAFI coordinator in 2010. And three phases that I would like to share with you for today. The first one is the past role of the nurse as TAFI coordinator. And then the second is the change of the TAFI coordinator to structural heart intervention program coordinator. And then the future development as being the SHI program coordinator. Back to 2010, the first TAFI was performed in Hong Kong. The concept of the heart team and TAFI nurse coordinator has been emerged, of which this was regarded as a foreign idea before. The role of the TAVI nurse coordinator is not yet well defined. With the time of the learning, the role is more clearly defined. The nurse should be the first person for the patient to be contacted, who maneuver the patient's referral to the TAVI procedure. The nurses should have good communication skills because the nurse has to communicate different disciplines, including the surgeon, cardiologist, anesthesiologist, and also radiologist as well. Of course, the nurse has to continue to monitor the patient and provide the continuous of care, such as the education and also the direct patient care. Here is the buckboard diagram that summarizes the TAVI nurse coordinator. As I mentioned, the nurse coordinator has to provide the education to the patient and the family to assess the patient assessment, of course to provide the direct patient care. Good communication skills to communicate different disciplines, to prepare the material for the heart team meeting, for the discussion of the TAVI for each case, to manage the waiting list, and of course to coordinate the diagnostic workup. And after the TAVI, have to schedule the follow-up and also to collect the data for the patient management subsequently. With the structural heart intervention is potentially expanded, we are now not only to intervene one valve, but the whole heart, such as a mitral clip, tri-clip LAAO, alcohol ablation, ASD or co-share, etc. So we are no longer just the TAVI coordinator, but structural heart intervention program coordinator. We have to integrate the best practice into the daily practice to keep abreast of the latest technology by attending different symposium or conference. So the role is shift from day-to-day tasks to program improvement and also to optimize the practice. Training is the best way to improve and update the skills and knowledge. The nurse coordinator have to organize and coordinate for the training to the doctors and also the nurses as well. Actually, other than that, we are not just to sustain, but improve the program. We have to support and coordinate the research of SHI to handle the financial matters. You know, in Hong Kong, the patient have to pay by themselves for the device and all the structural heart intervention. So if the patient have any financial difficulties, we have to refer the patient to seek the medical social support, or even to liaise for the donation. In order to improve the program, we have to develop the database and keep the registry consisting of all relevant demographic, intra-procedural, post-procedure, and also all the clinical outcome data. In order to facilitate the referral mechanism to sustain the program, we also design the referral form for other discipline or even other hospital to refer the patient to our team for assessment and then arrange the SHI. And other than that, we also prepare the procedural document, including the pre-operative and post-operative management in order to standardize and provide quality care. Other than that, we also design some antibiotic reminder card to the patient to remind them to have the antibiotic prophylactic before the dental procedure after the SHI intervention. And team-based care is one of the key elements for the program to be successful. So in order to optimize this, the structural heart intervention program coordinator should be involved in every stage of the patient journey from referral to discharge. In order to provide the best patient outcome, we have to manage the patient and process the care through the good communication and also the multidisciplinary collaboration. Here is one of the cases I would like to share with you for how being the coordinator to handle the patient with multidisciplinary collaboration and also with good communication. Mr. Chen, a non-survey AS, pending to have a TAFI after the heart team meeting. All the pre-operative investigation was arranged. Unfortunately, the patient suspected to have lung cancer after the pre-operative CT. So urgent referral to the CT assessment for assessment was arranged. After consultation, the lung lesion was found to be operable with the life expectancy over 1 year. However, the survey AS have to be resolved before lung operation to be arranged. So after discussion with our cardiologist, the urgent TAFI was arranged and have been done already. Now the patient is now waiting for the lung surgery. In the past, the TAFI coordinator acts as a passive member and passive role, but now we are now become more active in the heart team. In order to provide a better patient outcome, we initiate the protocol, the NurseNet mobilization protocol. As you know, the big ball delivery shift is used for the TAFI, and the patient have to be to have a strict bed rest in the first 24 hours. With the improvement of the delivery shift and also a numerous study was carried out in the Western country, we have designed our nursing protocol for the patient to have an early mobilization after 4 hours if patient is feasible. This protocol can help to facilitate the patient to have a rapid patient return to the baseline physical status and also prevent deconditioning, of course, to have a better patient safety and early discharge. Since the pilot in 2020, this protocol has been routinely used for all the patients if the patient is feasible to have an early mobilization now in our hospital. Here's the another bubble diagram to summarize for the SHI program coordinator. The highlight for bubble is the additional role that being the program coordinator. As I mentioned, protocol development, the NurseNet mobilization protocol, to organize and also to coordinate the training for the doctor and also the nurses, assessment form development, and also, of course, to support the research. Then how about in the future? As you know, the innovative practice have been crucial to the development of this specialist structural heart service. So therefore, the role of the SHI program coordinator will be continued to evolve. So SHI nursing team should be set up because, as you know, the structural heart intervention is continue to develop service. The whole service continue to develop. Not only just one program coordinator can tackle such a huge service. The workaround after the procedure with cardiologists, it will enhance the consistency of the care and also to have a better post-procedural assessment arrangement, such as an echocardiogram, to set up the nurse clinic so that we can follow up the patient after discharge in order to have provide the care continuously. And also, with the more experience gain and also competence of the nurse coordinator, we may consider the nurse can not only to assist to obtain the consent, but to obtain the consent independently if the appropriate consent training by our cardiologist. In order to make a coordination role more visible in practice, we can develop the specific instrument to measure the impact of the coordinator-led intervention on the patient experience and outcomes. As I mentioned before, the nurse should be involved in every stage of the journey. So as a program instructor, program coordinator, we should not only just scrub in for the TAFI, but all structural heart intervention. Then is it possible to be the second operator in a valvular intervention? In UK, there's a pilot for the program nurse coordinator to be the second operator for the mitral clip in 2020 in UK. So is it possible to bring this idea to Hong Kong? Of course, this topic can be explored in the future. This is the end of my presentation, and thank you for your attention.
Thank you. Thank you, Ms. Chen. So this session is open to question to the audience and on the floor. May I invite all previous speakers to the front?
Maybe I start off to ask a question first, because there's a lot of talk concerning the structural heart intervention coordinator. So in this regard, what would be the most difficult part in the coordination? So would the speaker try to share their experience on that? Maybe anyone, yeah. So feel free to. Maybe Ms. Chen first, and then.
Actually, I think the most difficult one is to have communication among these different disciplines, because we have to tackle anaesthetists and other surgeons or even radiologists. So you should have a good, very good communication skills to deliver the message and get their support, and also to get their help.
Any thoughts from others?
I would comment that the communication is always the most challenging in a team when you're dealing with a process and that is as complex as is necessary with structural interventions. I think that we can lay down a process where we have smooth communication, like even we're routinely adding in additional communication points, discharge rounds at the end with just our nursing teams, inpatient and outpatient. But when we really run into issues is when we have a patient that has unique needs. Ms. Chen gave a wonderful example of a patient who had identified a potential cancer lesion on the CT, and those cases that are off the pathway and require additional coordination and intervention to try and keep the patient. We know that they die from aortic stenosis if we don't pay attention to it and address it in a timely fashion. And when you add variables in, like incidental findings on CT that have to be explored, that's where when the communication gets a little more complex.
So regarding to the difficulty, focus to my center, our nurse, as a nursing coordinator, just mentioned that it's not only one nurse pick up this role, because we have 2 to 3 nurses, catnap nurses, to share this role, because at this moment, no definite nurse coordinator position, like maybe in other countries they have a dedicated nurse coordinator who only work with the coordination from the patient as receive the referral up to till the end of the continuous follow-up. But at this and my situation is the nurses maybe only have to work on operative preparation, and other nurse as a coordinator is work inside the cath lab for the preparation of the maybe instrument order or some lab design. We hope to have further consideration to have a position for this coordinator, which only work with the structural heart intervention program. It's my expectation to have this role in the future.
In my opinion, because we don't have a designated the structural heart coordinator in my hospital currently, and if you need to ask me the most difficult problem we encounter is that we are too busy to have the daily operation. And if you need a structural coordinator, you really need a designated person to discuss with the team, discuss with the patient, and for arrangement of the test. And this requires an extra manpower, and that's the main problem we encounter currently in my organization. And another problem I think we may encounter is that we need to gain trust with the cardiologist. And of course, we need to gain reputation from the cardiologist. We need to have more training and more update of our knowledge, so that we can have equal position with the interventionalists or the NES team. So to gain more power or kind of work. And we need support from our organization to have more funding for training, and of course more manpower is needed.
I have a question. I realized that all of you come from a very prestigious hospitals that many research must be going on. And my question to you is, as a nurse coordinator, how do you work with the research team, and what's the role of a nursing coordinator in the research process in the structural heart disease and the interventions? Thank you.
So I'll start with that question. At Henry Ford in Detroit, Michigan, we have our research team and our clinical nursing team are in the same hallway. When they research and the nurses all attend case conference. When decisions are being made to consider a research protocol, particularly in our tricuspid space, the research team is there and they work jointly together. We do have nurses on our research team. And so having that close proximity, the communication extends back and forth. We have to be a little bit careful in that research testing and requirements can only be ordered by the people that are on the research protocol. And our clinical nurses, they're not on all the research, just too many. They can't be on all the research protocols. So it's an interesting, a little bit dynamic and a lot of communicating back and forth. Now that we have nurses on our research protocols, it's less of an issue because they can order the testing or whatever is needed, but they do need to keep the clinical team informed for the patient process.
Actually, in QE, I also have to oversee the research team in research in our cardiac team. So fortunately, I have a clerical support for my team. So actually, it is not difficult for me to coordinate the research for the medical side, also the nursing side. So it's not much difficult for me.
So the time is actually running short, so we have a really packed schedule here. So we have a really fruitful discussion about the structural heart intervention coordination in United States as well in Hong Kong. We all learn a lot here. So let's give a round of applause to our prestige speaker here. Thank you all for your participation, but stay tuned. We will be back for our most challenging case presentations. So thank you a lot.